Could you talk a little bit about when we may see the COVID-19 vaccines available?
Sure. And of course, this is where I think a large portion of the US as well as world population might be a little bit overly optimistic based on what's been reported in the public and also based on the reaction, for example, of the stock market. As people understandably want to feel some hope, right? We have maybe some light at the end of the tunnel, which is the analogy that many of the experts have used. So that's the good news. Of course, the more reserved news is that it's going to take a while in order for these vaccines, and I say these vaccines because there again are multiple candidates. And in fact, I also want to emphasize there are candidates still in that phase 3 testing that very well may also prove to have similar results as the two that we've talked about, which would not be a bad thing because that will just sort of provide more access from a supply chain perspective. But the truth be told is that almost immediately, if emergency use authorization is provided, doses of this vaccine will be available to millions of people, but not to 330 million people in the United States any time within a couple months. And certainly, if we think about the global population, not enough to satisfy the needs of the global population in short order either. So I don't know the numbers exactly off the top of my head, but I want to say that I've read in the course of one of these promising candidates, there might be 12.5 million doses available to the U.S. population. In another one, it might be something on the order of maybe 22 million or something like that. And the good news about this, and also sort of an interesting component of this Operation Warp Speed, is that there has not only been an investment in speeding up the science, but there's also been some bets placed in terms of manufacturing large doses without knowing whether these things actually would prove to be useful or not. Given the results, the advantage is that we do have multiple millions of doses available, as I understand it right now. But there are a couple other issues. We need to produce and manufacture more. And one of the challenges that we're reading is that that's not simple. So even though we know how to do the manufacturing, and even though millions of doses have been manufactured already, there are some real supply chain issues. For example, just raw material supplies that are in short supply. So that things needed to actually manufacture more doses are hard to come by kind of on the market. And those are issues that are being addressed. The notable example that I read about is the sort of highly customized plastic liner that sort of lines the vat or sort of the container in which sort of the vaccine is stored. But also things like syringes and vials and things of that nature, which need to be accumulated in order to transport this. So there really is ramping up the supply chain to meet the demands both of the US and the global population. And that's going to take some time. There's also just the distribution issues. It's been widely reported that storage of these vaccines, particularly I think the Pfizer vaccine in particular, has to be at very, very cold temperatures. And so thinking about, not only how you store it in one physical location, but how you transport it to multiple physical locations. Other logistics that, many of us take for granted, who distributes the vaccine? Is this done at physicians' offices? Is this done at hospital locations? Is this done in parking lots at tents? Or is this done at retail pharmacies or all of the above? And so, I think the way that I would, sort of read the news, and you may have some of your own insight here, Will, is that there will be likely, if emergency use authorization is granted, the ability to distribute millions of doses in the United States and around the world. But those will probably need to be prioritized first, to our healthcare workers, to our vulnerable populations. But still, we're going to be months away, if not more than a year or more away from being able to get to the point where the entire US or world population certainly will be able to receive this vaccine. And we'll actually talk about in another segment, sort of underdeveloped or developing countries and sort of the ethics of distribution. But